Did you know that some of the first signs of serious illness in older adults can be spotted just by looking at their hygiene habits? Not by complicated tests or scans, but simply by the way we care for ourselves day to day. It's both a little unsettling and deeply empowering because it means we have more control than we think. And if you're over 60 or care for someone who is, what I'm about to share could genuinely help you avoid health complications down the line. Let me ask you something. Where are you from? And what little daily rituals do you have when it comes to your personal care? Pop your answer in the comments. I'd love to know. Every town, every family has their own way. Now let's imagine this. You're at your GP's for a routine checkup. Nothing seems wrong, but within minutes your doctor starts asking unusual questions, questions that seem unrelated. Have you been brushing regularly? Do you use cotton buds in your ears? And just like that, the conversation shifts. What your doctor sees on the outside may be hinting at something serious on the inside. You see, when we age, hygiene isn't just about staying fresh. It becomes a window into our overall health. And these aren't cosmetic concerns, they're often warning signs. Let me walk you through 5 of the most overlooked hygiene mistakes older adults make, ones that doctors in the UK are trained to spot immediately. I'll also tell you exactly what to do to protect yourself or someone you love. Now, this isn't meant to scare you, it's meant to empower you. Because each of these mistakes is fixable. Some take just a few seconds a day. Let's start with one most people don't think twice about: oral hygiene. Brushing our teeth can become so automatic that we forget how crucial it actually is. But dentists and GPs alike are raising the alarm. In fact, poor oral health is now linked to heart disease, dementia, and even strokes. It's not just about bad breath or dentures that don't fit. Bacteria from gum infections can sneak into the bloodstream and quietly wreak havoc. Most frightening of all, this can happen without any major symptoms. I remember speaking with a man from Kent, let's call him Alan, who prided himself on brushing every day. But he used the same toothbrush for nearly a year. It still had bristles, he said. What he didn't realize was that worn-out bristles weren't cleaning anything properly. His gums were quietly inflamed, bleeding slightly, and it wasn't until his doctor noticed swelling along his jawline that they found the connection. An undiagnosed heart condition potentially made worse by the infection in his mouth. So here's your action step. Check your toothbrush. If it's older than 3 months, replace it. An electric one is even better. They remove significantly more plaque. Brush for 2 full minutes, twice a day. Set a timer if you need to. Floss every evening, even if it's just a quick run-through. And yes, see your dentist, even if you have full dentures. They check for far more than just teeth. Now let's move to something a bit more personal. Bathing frequency. It's not uncommon to hear older adults say they bathe just once or twice a week, and sometimes that's down to mobility or fear of slipping. But your skin is your largest organ, and when you don't wash regularly, it becomes harder to spot signs of internal problems, things like liver trouble, kidney issues, or even diabetes. A retired lorry driver from Yorkshire once told me, "I didn't think missing a bath here and there mattered. I wasn't going anywhere." But when his GP noticed a patch of darkened skin under his arm during a flu jab appointment, it led to tests that caught early-stage diabetes. The discoloration was subtle, but visible. It could have been missed for months had he not rolled up his sleeve that day. The fix? Aim to bathe at least 3 times a week. Use warm, not hot, water, and go for a mild, fragrance-free soap. After you're dry, use a moisturizer while your skin is still a bit damp, and take time to check for odd marks, rashes, or patches of dry skin. These little clues can tell you a lot about your health. Now, I want you to do something right now. Glance at your nails. both your hands and feet. What do you see? Are they neat, clean, or have they become thickened, yellow, or brittle? To a trained eye, nails are like a health diary. Changes in color or shape can point to anemia, heart disease, or circulation issues. One lady I met at a community center in Norwich, Joyce, was convinced her yellow toenails were just from age. "They've always been a bit ugly," she chuckled. But when her chiropodist took a closer look, they uncovered a fungal infection that revealed an underlying immune problem. She was treated quickly, but she said to me later, "I never knew your nails could say so much about your insides. You don't need to become a nail expert, just make a habit of checking. Trim them straight across, keep them dry, and never ignore odd discoloration. If you see black spots, thick ridges, or nails lifting from the skin, get it looked at. And if trimming your own toenails becomes difficult, it's worth seeing a podiatrist. It's not vanity, it's maintenance." Now here comes a sensitive topic: managing incontinence. It's more common than you think, and yet hardly anyone talks about it. But let me tell you, the doctors noticed. The smell of ammonia, the rash from damp clothes, or even frequent bathroom questions. These are subtle flags they've been trained to spot. What many don't realize is that incontinence can be a symptom, not just a condition. It could point to bladder infections, prostate problems, or neurological changes. But because of embarrassment, many seniors try to manage it quietly, with tissues, plastic pants, or skipping outings altogether. I once spoke to a woman from Liverpool, Margaret, who used to avoid family dinners just in case. "I didn't want anyone to notice," she told me. But after developing painful skin sores, her GP discovered an underlying bladder issue that was completely treatable. Today she goes out regularly and says, "If only I'd known earlier how common it was." Please, if this affects you, don't suffer in silence. Talk to your doctor. There are fantastic modern solutions, from absorbent products to medications, that can restore dignity and comfort. Change pads regularly, keep the area clean, and protect your skin with barrier creams if needed. It's not just about hygiene, it's about quality of life. What many don't realize is that incontinence can be a symptom, not just a condition. It could point to bladder infections, prostate problems, or neurological changes. But because of embarrassment, many seniors try to manage it quietly, with tissues, plastic pants, or skipping outings altogether. I once spoke to a woman from Liverpool, Margaret, who used to avoid family dinners just in case. "I didn't want anyone to notice," she told me. But after developing painful skin sores, her GP discovered an underlying bladder issue that was completely treatable. Today she goes out regularly and says, "If only I'd known earlier how common it was." Please, if this affects you, don't suffer in silence. Talk to your doctor. There are fantastic modern solutions, from absorbent products to medications, that can restore dignity and comfort. Change pads regularly, keep the area clean, and protect your skin with barrier creams if needed. It's not just about hygiene, it's about quality of life. Finally, let's talk about your ears. Yes, your ears. You might not think of them as part of your hygiene routine, but they matter more than you'd expect. Older adults often use cotton buds to clean them, pushing the wax deeper or even damaging the eardrum. And some don't clean them at all, which can lead to infections and even hearing loss. There's a gentleman I know, Brian from Cornwall, who always used cotton buds. "That's what my dad did," he told me. But one day, he lost his balance getting out of bed. Turns out, an inner ear infection had been brewing quietly for weeks, thanks to impacted wax. Your ears clean themselves naturally. All you need to do is gently wipe the outer ear with a damp cloth. If you feel blocked or can't hear properly, don't poke. Book an appointment. There are safe eardrops available, and your GP can help if wax becomes an issue. Hearing is precious. It connects you to loved ones, to music, to conversation. Don't risk losing it. So, let's recap, not with a list, but with a reminder. Every one of these hygiene areas isn't just about keeping clean. They're quiet messengers. They can whisper the first signs of something more serious. And the earlier we listen, the better chance we have of staying strong, independent, and connected to the life we love. So here's your challenge. Tonight, take 5 minutes, just 5, and check in with yourself. Your toothbrush, your nails, your bathing routine, your feet, your ears. And if something doesn't feel right, don't ignore it. If this video helped you in any way, please give it a like. It really supports the channel. Have you ever had a doctor spot something small that turned out to be a bigger issue? Share your experience in the comments. I read every single one. And don't forget to subscribe to Gentle Elderly Lessons for more down-to-earth advice made just for you. You're never too old to learn something new. And before you go, share this with someone over 60 who you care about. You might just help them catch something in time. And always try and remember to smile when you're happy and cry when you're sad. Stay positive when things are hard and grateful for all that you have.